like has been said, we also will be grateful to Don and your team for all the support. We have been worried on our part for the fact that we are achieving very low death registration coverage in particular. We have done a lot with births, but then we realized that death registration was really not catching up well. And so when this intervention came, we saw an opportunity to try and also increase and improve death registration coverage and also be able to establish exact causes of deaths as we record the events. It is our hope that when it catches up well, after the pilots and probably a scale up, we will begin to also see a rise, a steady rise in death registration coverage as well as cause of death data, which will be useful for policy. So we are keeping our fingers crossed. I hope that things will work out well for us.
We are really very, very pleased to hear that because that is one of the main objectives. It's not only the technical assistance from the research that people like Don and myself and others do. This is much more than that. We are not trying to create new systems. We're trying to help countries integrate and benefit and make more cost-effective their current systems, which is exactly what you're describing. And I think you should take great pride in Ghana from what Don has reminded us, that you will be the first of these 20 countries that will be able to effectively demonstrate not only this integration across your partners, your government agencies responsible for vital registration, but also the fact that you're adopting rapidly technologies that are making this more efficient and more accurate. And more efficient, more up-to-date, more accurate information will be essential for health policy to keep more Ghanaians alive well into old age.
It's become really clear to us that there's a level of commitment amongst people on the ground. They share your vision, and that's what's driving this forward. It's coming from the government, you're pushing it along, your vision, and it's also been, you've managed to infect the people on the ground who share your vision, who will drive it forward.
And this is the 21st century when we're aiming for SDG goals, we're aiming to meet targets, and it just makes it a great pleasure to work in Ghana. And I would suggest that you don't judge yourself by whether you've moved your registration from 20% to 30%, but you judge yourself by the fact that you are changing the way in which systems are cooperating and benefiting from these technologies. And Don is a champion of these systems approaches.
You'll be the first country in the world, I think, to have this digital notification, registration, and cause of death all coming together. So this is the big, I think, win here in Ghana is connecting GSS, DHS, and BDR into this final year to really have quantum change in performance of the system.
So along the chain, Ben and a few others, we looked at working to plant a few new registration centers just to expand the coverage and the scope. so it means that with their presence here and a few other things that we'll fold out later, we will be able to get access to support to open a few new registries, especially in the deprived communities. And the strategy is to look at what is a bit cost effective, not any imposing structure, but something that will be worthwhile, which will serve as a one-stop station to capture births, deaths, and if it marries or something, all at one point.
What we also wanted to do was just to, in listening to you, to try to reinforce the idea that this has been neglected in most countries, not just Ghana, but most countries in the world, for as long as we've been alive, for the last 7-8 decades. And now we're at an era in the development of civil registration and vital statistics systems of rapid change. And we have to accept that we won't change 5 or 6 decades of inertia very quickly. But we have a better chance than ever before of doing the right thing, doing sustainable things that are capable and are pragmatic and useful in Ghana, but that you will continue to develop those with less and less guidance from us. That you've got very capable, well-trained people. We, for example, have a fellowship program where we're bringing Emmanuel to Basel and then to Melbourne. We share fellows. We teach them a little bit more about the sustainability, the key tenets of a civil registration system, so that they come back as champions to their country. It's just now a matter, as you say, of expanding to those under-registered, underserved communities, doing it in a strategic way, understanding you can't do everything immediately, but you can do incremental priority things. The cause of death information that you need for your planning is critically important, because your health services and health policies will be orientated differently to prevent different diseases and injuries. We are here to listen and to tweak a little bit our programs if there's a way in which we can support you better, to prepare you better for the next 4 to 5 years of this journey. Everything I've heard seems to be in exactly the right direction. Are you well enough prepared to continue this outstanding development work that you're doing?
We want to assure you that on our part, we will do everything possible within our strengths to ensure that this program does not end with wounded support. It means that with your support, we will initiate and kickstart the process as well. We will take it up as our own, run with it, and ensure that we have something to show the world.
I just want to reinforce something that Emmanuel said, which was part of the philosophy, not only in Ghana, but we are promoting in all the countries that we work in. And that is, we'd like to make sure that countries benefit from proof of principle, from science, that an application of science that works. And so you should not feel that by the fact that we have not advocated for a whole of Ghana program in these 4 years is in any way leading to a diminished technical and scientific product for you. What we are trying to do, as Don and others have been bringing here, is to ensure that in populations, focal populations, the interventions that we are trialling are working. We evaluate and amend. And we do exactly the same thing in all the countries. In no country are we trying to change the entire national system. And you can imagine countries like China, very large populations, or Indonesia, you cannot possibly hope to change all of this in 4 years. But you can hope to ensure that methodologies are trialled and evaluated and proposed and integrated with governments in a way that they will lead to that sustainability we talk about.